Hi, my name is Linda, and I'm a student at the College of Nursing, and this is my badge. And scan the room. And today I'm going to be demonstrating administration of medications. So here I have the patient's chart and also the patient's MAR. The patient we are dealing with today is Mr. Jones, Mr. Jaguar J. Jones. Jaguar J. Jones, date of birth is 8/25/1963. Date of birth is 8/25/1963. Medical record number is 4176352. Medical record number is 4176352. Allergies to penicillin, allergy to penicillin, and medication administered that we are going to administer today is Novolin R, regular insulin, U100 insulin, Novolin R, regular insulin, U100 insulin. We are going to be administering 10 units and administering 10 units. Route would be subcutaneously. Route is subcutaneously. Time would be 30 minutes before meals. Time would be 30 minutes before meals. And indication is for diabetes. So now I'm going to be doing my hand hygiene. And I'm going to be going through the 7 rights of medication administration, which first would be the right patient, which we have Mr. Jaguar J. Jones. Mr. Jaguar J. Jones, date of birth is 8/25/1963. Date of birth is 8/25/1963. Medical record number is 4176352. Medical number is 4176352. And right to medication is Novolin R, regular insulin, U100 insulin. Novolin R, regular insulin, U100 insulin. Now I'm going to select my medication, Novolin R, regular insulin, U100 insulin. Expiration is 12/1/25 at 800, which is still good to use. And I'm going to go ahead and clean the top of my vial. Okay, and now the right route would be subcutaneously. Right route is subcutaneously. Right dosage would be 10 units. Right dosage would be 10 units. Now I will select my syringe, which will be the 0.5 milliliter insulin safety syringe. Okay, and now the right time would be 30 minutes before meals. Right time is 30 minutes before meals. Right indication is for diabetes. Right documentation, all elements of a legal prescription are included. Now I'm going to go ahead and draw up my medication. I'm going to remove this cap and I'm going to draw 10 units of air into my syringe. And I'm going to inject that into my vial. And now I'm going to flip my vial and draw 10 units of insulin. And I can tap it to get any air bubbles out. And that is 10 units. Okay, now I'm going to recap my medication to use later. And now I'm going to have another nurse look at my medication, and I'm gonna grab my vial and my MAR and have that nurse compare or confirm that this is the right dosage and medication, which is Novolin R, regular insulin, U100 insulin, Novolin R, regular insulin, U100 insulin, Novolin R, regular insulin, U100 insulin. And this is 10 units, 10 units, 10 units, and it would be administered route would be subcutaneously, administered route would be subcutaneously, which this needle is great for subcutaneous injections because it's a smaller and shorter syringe. And it will be administered 30 minutes before meals, administered 30 minutes before meals. Okay, and indication would be for diabetes. And now I'm going to go ahead and label my syringe with a piece of tape with the patient's name, drug name, and dosage onto my syringe. Okay, and now I'm going to grab my MAR, my medication vial, and my medication syringe, and go to the patient's room. And first I'm going to perform my hand hygiene. And now I'm going to greet the patient. And hello, Mr. Jones. My name is Linda, and I will be administering your medication today. First, let me verify that you are Mr. Jones. So Mr. Jaguar J. Jones, I'm going to check your armband, which is Mr. Jaguar J. Jones. Date of birth is 8/25/1963. Date of birth is 8/25/1963. Medical record number is 4176352. Medical record number is 4176352. And you are allergic to penicillin, and you have an allergy band to penicillin. Mr. Jones, do you have any other drug-related allergies that we need to know of, or any allergies at all? No? Okay, great. So now I'm going to double check my third check for the 7 rights. So I'm going to make sure it's the right patient. So my syringe says Mr. Jaguar J. Jones, Mr. Jaguar J. Jones, Jaguar J. Jones. Date of birth is 8/25/1963. Date of birth 8/25/1963. Medical record number is 4176352. Medical record number is 4176352. The right medication is Novolin R, regular insulin. And right medication is Novolin R, regular insulin, U100 insulin. And this is Novolin R, regular insulin, U100 insulin. And the right route would be subcutaneously. So we will be administering with this shorter needle subcutaneously. And right dosage is 10 units, and right dosage is 10 units. It's 10 units in this syringe. And right time would be 30 minutes before meals. And right indication would be for diabetes, and right documentation. All elements of a legal prescription are included. So now I'm going to don my gloves. And my goggles. And I would adjust the patient's bed to a workable height, lower the bed rails, and then now I'm going to position the patient for comfort. And then I would assess the area of the medication injection site. So since this is going to be subcutaneous, I'm going, and it's for insulin, I'm going to be injecting it in his abdomen. And I'm going to assess the area to see if there are any lesions, bruises, scars, and which he doesn't have any. And now I'm going to clean the site of injection. And I would start in the middle where the injection would be and clean outwards. And now I'm going to grab my syringe, remove my cap, and make sure it is 10 units of Novolin R, regular insulin. And now since this is a subcutaneous injection, I'm going to pinch the skin for 1 inch and angle my needle 45 degrees and insert the needle and slowly inject. medication. And now I would apply slight pressure with an alcohol prep pad, and I would discard my syringe in the sharps container. And for insulin, I would not aspirate for any blood since it is insulin. And now I'm going to discard that. And now I would check the patient's injection site to see if there's any reaction. And now I would go and document the procedure and outside of the room, and then I will come back to assess the patient to see if there's any drug reactions, any allergic reactions. So that would conclude my administration medication video. Thank you.